Yep, yay. Okay, so as I was saying, whether you're here as a therapist or a student or a person who's had a stroke or even a carer, the aim of this evening is to give you ideas for improving hand function, specifically grasp and manipulation. And at the front of the presentation there'll be a little bit of repetition of some of the slides from the last part 1 session, part A session, about essential components and some of the aspects of the key messages you'll find will be similar. So the outline is that we're going to look at hand function in relation to a number of tasks using knife and fork, handwriting, and I'll start with manipulating a glass or a cup. And so we'll look at eliciting muscle contractions for people who perhaps don't have sufficient finger flexion or wrist extension to be able to use an object, how to strengthen and improve coordination, and then how to link exercises together. And at the end there are a few slides looking at the most current evidence, mainly the systematic reviews in relation to the different interventions. So take-home messages are very similar to the previous lecture. Is that you need to analyse each skill carefully, and that's what we're about to do. And you will need to not only know the muscles that are involved in the task, but how they would usually be coordinated together and work together. Again, a reminder that the hand drives the shoulder. So when we're engaged in setting up some practice for somebody, it's important that the person has an object in their hand. Now, when you're looking at advanced hand function, that's much easier to do, but it's important to keep reminding yourself that. Again, if you're a person who tends to use your hands a lot and put your hands around somebody, keep your hands off. People need to practice on their own, and we need to set up the environment and practice right from the beginning with the intention of the person practicing on their own. Practice doesn't have to be perfect, so if you're really worried about the person not practicing beautifully, you just have to learn to be okay about that and relax with that. Because people need to practice hundreds and thousands of repetitions to get better at a skill, particular skill like writing or handwriting, or using cutlery. And of course, when you allocate practice, you need to remember to review it and give some feedback to people about their practice. And you can do that by distance. You don't have to be in the room with the person. With Skype and FaceTime, you can do that remotely, and certainly I'd encourage you to think much more about doing that. People can send you videos, and we're seeing that happening more and more. Therapists sending us videos of somebody that they're working with, or even stroke participants sending us videos from places like India and all over Australia to get a bit of advice. And importantly, expect that people will change within a session and between sessions. And if they're not, be worried about it. Be worried about what you're suggesting and what you're prescribing and what you need to do differently. So, looking at analysis and the essential components, for those of you who weren't at the first presentation or who are not familiar with this, essential components are the features that you will see, the elements that you will see and expect to see when people do a task. And these features are common across individuals. And we'll talk about the kinematics, what you would expect to see when you watch somebody in front of you or when you watch them on a video. What you should expect to see their arm doing, what you should expect to see their hand doing. And then there are the kinematic requirements, and Karl will talk a little later about how to train force control or pressure control for people who press too hard when they pick an object up or use too many muscles. Not because they have spasticity, just they're using too many muscles because they don't have good coordination and good dexterity. We'll also look at changing the environment. So you've seen this before if you were here the last time, an image of the homunculus, an area of the brain, a representation of how much of your brain is dedicated to the hand. You can see a very large representation of the hand compared with the feet and compared with the shoulder even, because we explore our environment with our hand. So if we move on to grasp and manipulation, starting initially with the grasp phase. So in the last presentation, we were looking at reaching, which is transport, what happens at your shoulder, what you would expect to see at your shoulder, and then pre-shaping with your hand, what you would expect to see somebody's wrist, forearm, fingers and thumb doing when you watch them reaching normally. And now we're going to look much more at the hand, thumb and the fingers and the coordination of those different items. So when somebody's grasping, that's essentially the point where they're making contact with it, when they're closing their fingers around an object. And so you're looking at the configuration of the fingers and the thumb. Many of the tasks that we'll be looking at tonight involve in-hand manipulation at the same time as you grasp. It's not a linear process. It's not that you grasp and then you manipulate the object. You think about picking up a pen. You're doing the in-hand manipulation at the same time as you pick up the pen. You have an intention to perhaps write with it, perhaps to take the lid off the pen. Maybe you're just going to play with it, but you have an intention, and as soon as you pick up the pen, the way you pick up the pen will be driven very much by your intention. With something like a glass or a cup, you'll also do some in-hand manipulation, but it's less obvious because you're making adjustments to the pressure and to the positioning of your fingers. If you're picking up a coffee mug, on the other hand, you will have to do some manipulation as you identify how heavy the object is and how much control you need with your thumb and your fingers. But we'll talk about grasp and manipulation separately because it's helpful when you're analysing to think about what happens at the point of grasp and then the in-hand manipulation. And it's also about the ability to use your thumb and fingers skillfully, whether it's playing the guitar, playing the accordion, using cutlery, writing, and so on and so forth. So if we think about testing hypotheses, we observe the task or the skill that we're looking at. We might need to identify whether the person has any muscle length changes. So for example, it's not uncommon that people might have some shortening or stiffness in their wrist and their fingers, and that's affecting their ability to, for example, extend their wrist when they're reaching for an object. So that's a common muscle group that you might have to check, your wrist and finger flexors. Or somebody might not be able to abduct their thumb for a larger object, and they may have a contraction or stiffness in their thumb, which will interfere with their performance. And then, as I mentioned before, it's not uncommon when people are learning a new skill that they'll use too many muscles. Think about when you're learning a yoga move, or you're learning to ski, or you're learning a musical instrument and how to play. You use more muscles than you need because it's difficult to get everything to work correctly. And it's the same for people who've had a stroke or brain impairment, that they may switch on more muscles than they need, particularly if, for example, their finger flexors are weak, or they have difficulty holding onto an object. They'll use a lot more muscles than they need. So if you have a glass or a cup in front of you, you can place it on your knee and make the shape that it is. If not, you have a glass in front on the screen that you can make your hand around that shape. What you're seeing here, if we think about the photograph on the bottom right here, is wrist extension. So you're getting the fingers out of the way in order to send your hand and your thumb directly towards the glass. You're moving your fingers and the ends of your fingers out of the way. Your thumb abducts, so it comes around and opposes your fingers, particularly your middle finger, and then at the point of grasp it will close and adduct. Your fingers will need to initially will open, and then it will need to close around the glass. And to swallow the glass, obviously, the more you will see closure at your knuckle joints. And your lumbricals mainly are responsible for that. You'll have some closure at the end of your fingers, so the flexion of the small joints of your fingers and your thumb. And this rotation at the base of your thumb, as well as your fingers, to make that cupping shape that you see in the photograph there. So this conjunct rotation happens at the base of your thumb, and results in opposition, results in the pad of your thumb coming around to give you good contact when you're about to pick up the object. And in this case, because it's quite a long wine glass in the photograph, there's some abduction. And the same would apply if you were picking up a coffee cup. You want to make sure you have good contact and good control around the length of the cup of the glass. So we're going to look at this man here who's reaching for a jar with some beans in it. And think about what he's doing that's different from the last photograph you just saw, particularly at the point of grasp. If you look at your list on the handout of the essential components of reaching for a glass, certainly it's a different object. It's lower than the wine glass in the previous photograph. It's not quite as delicate or as fragile as the wine glass. But he's missing a couple of essential components there. So what would you say he's missing particularly? What's most obvious?
Wrist extension.
Wrist extension, that's right. So as he reaches forwards, he's in a sort of neutral position at his wrist. So that would be certainly a feature you would want to check. Can he extend his wrist with the glass or with the jar in his hand, yes or no? Just getting him to hold on to it. Can he extend his wrist, yes or no? But it's likely he's having difficulty with wrist extension combined with opening his hand. Is there anything else that looks different at the point of grasp? So the rotation of his thumb. What is his thumb actually doing there? He's making a space, but how is he making a space with his thumb? He's extending his thumb. You have a look at his thumb, it lifts up instead of moving around opposite his middle finger. Yeah. So he's probably pronating as a compensation for his thumb not being able to move around into abduction. So that's just an example of watching somebody attempt a task. We'll move on now to more complex tasks with a knife and fork. But at where is the skill breaking down? What is missing in terms of this man's performance? What else is obvious about his fingers? If you think about the shape of his fingers. At the point of grasp, you would be expecting somebody to close their fingers, to flex their fingers around the glass or around the jar. And he's much too extended. He's having a lot of difficulty making the shape that you would normally expect to see. Okay. I'm going to pass on to Karl. We're going to look now at analysing a fork. We'll stay with the fork, but the same principles will apply for a knife.
Okay, so I suppose one of the things that's really critical, and particularly with hand use, is that there are many factors to look at. And there are many degrees of freedom in terms of how you can use your hand. So that last example, for example, we saw that maybe he lacks wrist extension, or perhaps he doesn't lack wrist extension, but he's not extending his wrist enough because he needs to compensate for what he can't do with his thumb. And maybe he's compensating with his fingers and extending them rather than keeping them in a flexed position because he can't abduct his thumb enough, and that's another way to make a larger space. So we need to be quite critical about what we're seeing to then be able to make quite specific hypotheses around why somebody can or can't do something. But we're going to look at specifically a fork today, but if you're going to analyse a knife, it's actually different from a fork, even though it looks quite similar. In fact, the way you hold them is different. But we're going to concentrate on a fork today. So when you grasp a fork, there's a certain shape that you have that's there available to you to reach for, which means that you need to be able to shape your hand in the appropriate space. And if you imagine your pens, for example, being a fork, it's a bit silly in some ways, but you have a long, narrow object that you're reaching for. You need to be able to get your fingers and your thumb opposite one another. You need to make enough of a space to fit your thumb and your fingers around that. So you need some forearm pronation. You need a little wrist flexion to be able to lower your fingers, but it probably depends upon the height of the table. And then you will need some flexion of those fingers to be able to get them to meet along the barrel or the handle of the fork. And the critical thing about hand use, and it's something that you really do need to look at with great diligence, is the capacity to be able to get your thumb to oppose your fingers appropriately. And the opposition is not only what you see, but the way the forces are applied. Those common situations when somebody tries to pick up a pen, for example, and they seem to get their hand in the right position, but the pen spins when they try to pick it up. In other words, they may get their hand in a what approximates the right position, but in fact when they try to pick it up, the forces aren't being applied in an opposite way, an equal manner, and so they will spin. And so we need to be very careful about analysing the capacity of the thumb and the fingers to meet along some sort of central point to be able to pick something up, such as a fork that's long and skinny. So you need some IP flexion as well, particularly when you start to then place it in your hand. So it's quite a sophisticated thing we do, even though we don't think about it when we going to have a meal or whatever. But what you actually do to get the fork in the right place is quite a sophisticated relationship between muscles that are external to the hand and within the hand. And we'll talk about that in a little bit more detail. Now this photograph doesn't come up as well as it does on the screen here, but this man is using a knife and fork, and there are some distinct differences between the way he's actually holding the fork and the way he's holding the knife. So, just at the outline here, you can see, in fact, his shirt probably gives it away in terms of the position of his arm, but you can see here that his right arm is by his side, the back of his hand is beautifully curved here, so his ring and little fingers can then meet along the handle of the knife. If you look at his left arm, he's quite abducted. So his arm's out to the side. You can see the distal end of his index finger is quite white. He's actually using way too much force on his index finger. Even though here his knife is cutting, it's not applying nearly as much force on the knife to cut the bread. So his arm is abducted and it's also internally rotated slightly. The other thing that's quite different, and you can see, I think, reasonably clearly in the photograph, the back of his right hand is quite curved. That conjunct rotation of his fingers around the handle of the knife, which enables him to hold the knife, is not there when he's holding the fork. In fact, the back of his hand here is quite flat. You can see that the MCP joints here, the knuckles of his hand, are actually, the whole of the hand is quite flat. And so the problem with that is that if you can't get the conjunct rotation around the handle of the fork, then in fact your ring and little fingers, effectively what they're doing is that they're flexing, but they're not actually coming across the handle of the fork. So it means that in fact what you're seeing is a fork that's completely unstable in the palm of the hand. So then you use the rest of the arm to try to compensate. So he's abducted. You can see this rotation of the back of his right hand here, which he doesn't have in his left hand. And he's using excessive force through his index finger and also through his thumb. It's a bit hard to see there. And perhaps what's going on at his shoulder is in fact trying to keep this unstable thing in his hand. And if you look a little more closely, you can see that he's on the side of his index finger and his thumb is working really, really hard to try to keep this fork stable in his hand. The problem though is that this is quite narrow here and it's just going to rotate because of the force that he's applying here is not going to be successful in terms of keeping the fork in place, and that's what happens. And so he is able to flex, and this looks okay. But unless he can then begin to get the conjunct rotation to be able to rotate the hand around the handle of the fork will always remain unstable in his hand. So you can train his shoulder as long as you like to keep his elbow in, and you can do all of these other things. Unless you fix the fact that this man doesn't have conjunct rotation of his ring and little fingers to be able to meet across the palm of his hand, the fork will never be stable in the palm of his hand, and he will compensate in some other way. So when you're analysing, it's really important to really start to dig down and work out where things are. So before mentioned picking up that cup, for example, maybe the first thing you need to do is think, okay, he doesn't extend his wrist enough, but if he maybe holds a cup in his hand, and can he extend his wrist? And if he can, you tick it off. It's not the problem. Even though when he reaches like that. It's not that he doesn't have wrist extension, is that he doesn't use his wrist extension because of something else that's missing. So it's really important that you analyse carefully. So this handout, you have this sort of format in your handouts, and it's a really helpful one to think about going through this in a really systematic and analytical way. Okay, what are you seeing? So there's excessive force in his index finger, his thumb, his shoulder's abducting. How come? Why is that happening? Then you can start to drill down. So decrease ring and little finger conjunct rotation, so maybe the thing to do is to ask him to turn the fork over. But that in its sense has in a way has some problems with it, because quite often somebody's trying to push down into the fork, they turn their hand over in this position. Quite commonly, the ring and little fingers just look as if they're in the right place. But when you turn the fork over again, they then lose control of those two fingers. So that's one possibility. Is using, it could be another reason that somebody can't sustain the force here. And if I can just get you to make a fist with your hands as strong as you can, you're kind of in that sort of mid position. Now flex your wrist and feel what happens to the force your fingers can apply. So this length-tension relationship for your flexors is a problem. So quite commonly people can hold a fork like this in the palm of their hand, can get the conjunct rotation, but the moment they begin to flex their wrists, they can no longer generate enough force in their ring and little fingers to keep the fork in place. So they're kind of dangling around in the air, but you can't see it because you can't get under their hand to have a look and see what's going on. So what do? You ask them to turn their hand over. What happens to their wrist? It goes into extension. They can hold on to the fork. You ask them to turn it over again, and lo and behold, the fork is unstable, and you look again, and so you need to really analyse these things quite carefully. So it could be that he has decreased ring and little finger flexor force in inner range. And inner range weakness is really common. You all know this, the fact that the person that can flex their elbow, but they can't get their hand to their mouth, that last little bit of elbow flexion. They can't get that last bit of wrist extension. They can't get that last bit of thumb abduction. Inner range weakness is really common. And maybe it's because they can't sustain the force. And so there's a whole range of things that you can then start to hypothesise about and then test. And usually your testing strategies will lead you to intervention strategies. And this is why it's so important that when you're analysing somebody's hand function, you get them to do something. Don't assess muscles in isolation without looking at a particular skill the person's trying to achieve. Because we can flap our fingers around and our hands around in all sorts of ways, but unless it's in relationship to a particular skill, you're not going to look at how those forces need to be applied. It's really important that you find something that person wants to do and assess that skill. Then you can start to put the muscles into their contexts. And out of that, you'll then start to derive strategies to be able to train. So here is the man that we were looking at before, reaching for the jar, and here he is one of his goals is to be able to chop up his sausages himself. So we have a video that he took on his phone. And this is a fairly extreme example of what we were seeing the other man doing. So if you see here, the fork is completely unstable in his hand. He's unable, even though he can extend his index finger a little bit, he's actually working to try to keep the fork stable in his hand. And you can see that unless he learns to be able to get his ring and little fingers to be able to flex as his wrist flexes in that position, that fork is never going to be stable in his hand. So for this man, this is his goal, and it's a good thing to look at to begin with, but then we've got to come back to this and see, okay, can he flex his ring and little fingers enough to be able to hold the fork? Can he get the conjunct rotation to be able to keep the fork in place? And maybe we need to measure how far those fingers are from the palm of his hand and give him a goal to be able to then gradually get closer to the palm of his hand to hold the fork in place. He wants to be able to go and have a meal with his wife in a restaurant without a built-up fork. He wants to be able to use cutlery normally again. And so our job is to find a way for him to become closer to being successful. So what I'm now going to do is have a bit of a think about the muscles that are involved, because they have quite different functions in terms, and it's something that's one of those sort of light bulb moments you have as a clinician. This idea that we have multiple muscles here in our forearm with long tendons, fairly small muscle bellies, but a vast number of muscles here which actually help us to flap our wrists around, wrist flexion extension, finger flexion extension. But then we have a whole range of small muscles within our hand that actually help us, and if you can all just have a go now, and just have a look at how, when you close your fingers, they meet around a central point. There's this really beautiful kind of shape that you have for your thumb and your fingers to meet. This capacity of our thumb and fingers to actually oppose one another, to be able to use things in such a sophisticated way, combined with our brains, have made us one of the most toxic species on this earth. But this capacity to do this is the combination not only of the extrinsic muscles to the hand, it's also the capacity of the muscles within the hand to then get those fingers to meet. If you just use your flexors, that's all that will happen, and you won't get this beautiful kind of formation that your thumb and your fingers can make where they meet in the centre. So the intrinsic muscles of your hand help the external muscles then be able to get your thumb and your fingers to meet. So we have the superficial flexors. I'm not going to go through them in great detail, but just to think about, no wonder we have such a hard time with electrical stimulation when we have this whole range of muscles we're trying to train. Then you have a middle layer of flexors, which are primarily your flexor muscles, but for the proximal joints of your fingers, and then the really deep muscles for the distal flexors of your fingers. And then the extensors, once again, you have the radius and ulnar extensors, and then finger extensors and so on, to then be able to flap your hand around and open your fingers. But within the hand, it's the combination of your adductors and your thenar eminence and your lumbricals that then enable your fingers to be able to meet around that central point in combination with flexion. And that capacity of your lumbricals, for example, to flex the MCP joints while you maintain some IP flexion is really important. Otherwise, your fingers are too long. If you just straighten your fingers out and try and get your thumb to meet the tips of your fingers, it doesn't. So you need to have some finger flexion, but in addition to that, you need the capacity for them to be able to meet together around that central point. So that's the combination of the intrinsic muscles of the hand in addition to the flexor muscles. So when we're analysing skills, it's really important to distinguish between, is it a problem with the extrinsic muscles, if you like, flexors, or is it to do with or they can't turn on the intrinsic muscles of the hand, or is it a combination of both of those together? So think very carefully about these muscles. So you have your interossei, abduction and adduction, and then your lumbricals, which actually help you to be able to flex and extend the MCP joints. And so then that means we can do all of these wonderful things with mobile. If you watch people with their mobile phone, it's a great way to see thumb abduction and flexion. It's how people use their thumbs with the phone. But this beautiful shape is essential for most of the things we're actually using our hands in a sophisticated way. So if we come back to Tony, he's got problems with the extrinsic muscles of his hand. He can't flex, he doesn't have enough flexor force to be able to keep the flexors working, to be able to at least hold the handle of the fork. But in addition to that, his intrinsic muscles don't bring his ring and little fingers across to the palm of his hand. So we then need to make a decision about where to start. So where do you think you would start, particularly with Tony? What would you... I mean, this is too hard, obviously, but it's the thing that he wants to do. But where might you start in terms of assessing what he is able to do? What do you want to find out about? Sorry? Yeah, so can he actually get his ring and little fingers to actually move across to it? So can he oppose his thumb and his little finger, for example? He's probably not going to be able to do it across the palm of his hand because he doesn't have enough flexor strength in a range to get his ring and little fingers to the palm of his hand. But does he have some conjunct rotation? Because that'd be fantastic. If he doesn't, then that's maybe something to begin to train. The other thing to find out about is what of his flexors does he have? Can he flex his fingers? Can he maintain? Can he do it with his wrist in extension? Can he do it with his wrist in a little bit of flexion? So you start to work out where the control problem lies and where he can start to get some change in his performance. So I'm now going to look at an example, a clinical example. Unfortunately, I don't have a video of this person, but just as a way, by example, of how you might go about training force production in somebody that has problems with both the extrinsic and intrinsic muscles of the hand. And this is a person that had a sort of not severe neglect, but certainly a left inattention and really didn't concentrate very well. So it was important to set them up with problems that required them to actually concentrate. So in this circumstance, they're trying to use the MCP joint to flex the index finger to push down on the fork to be able to get the end of the fork to move up between those two whiteboard markers, and then to be able to move the fork from side to side without knocking them over. And it's actually quite hard to do. So she's actually trying to keep the MCP flexion with some IP extension, which is what she needs to push down on the fork, and then to be able to move the fork from side to side, but without knocking these two pens over. So it actually requires her to concentrate, and concentrate hard, but also to really carefully control what she's doing. So, and she's actually doing that very well. But the problem is that this is okay, except that she needs to be able to maintain the IP extension of the index finger and flex the other fingers. So, this is now trying to do those two things together. So in this case, there's a set of tweezers here in the palm of the hand, and I'll show you what that looks like in a moment. And she's trying to push down, in this case, on a spoon, using MCP flexion, but you can see there's much more difficulty in getting the lumbricals to work here. She's tending to use the flexors more to pull down on the spoon instead of the lumbricals. If you just try it yourself, so flex your second, third and fourth fingers, and then just have a look at the base of your index finger. You can see that the lumbricals kind of stand out there. can on my sort of skinny old hands anyway. The lumbricals here are involved in doing that in combination with flexion. So she's having a hard time doing that, so she's using her IP flexors to try to help that, which is not what she needs. So that's what it looks like looking more externally. But looking from the other side, what she's got is those surgical tweezers, you know, those plastic tweezers with a coin in it. So she's trying to keep the coin in place while she pushes down with her index finger. And you can see that she's not making a bad fist of it, but there's still some things going wrong. She needs some feedback, she needs some coaching. She's holding the coin in place, but how is she getting the spoon to go up and down? What should she be doing, or what is she doing? Sorry, my hearing is... Yeah, she's actually using her wrist flexors to try to push down on it. In fact, to push down on the spoon. And what should she be doing? Flexing the MCP joint of the index finger. So she's close, but she still needs some specific training of that. But to get to that point took about 3 weeks. So initially, she wasn't able to actually hold the coin in place without looking at it. So here she is, she's just practicing it. The goal initially was to hold it in place for 30 seconds, keep it there, hang on, and then to be able to keep it in place and turn her hand over where she couldn't see it. And that was really quite difficult. Then to go from there to actually start to flex her wrist, and then to try and straighten her index finger. So those kind of building blocks along the way. And she needed to be able to set up her practice herself, because if somebody else put the coin in place, she just didn't attend to it. So she was actually required to do these things herself. So there she is, counting her way through. And that's her practice set up in the arm class. So she's got the tweezers there. There's her practice sheet. There's her counter. She counts her repetitions. She writes them on the sheet. And so she has a responsibility here to do her practice in the context of other people too that are around this table. And so she went from that initial one of trying to push down with her index finger to then practicing holding the coin, then turning her hand over, and then keeping the coin in place, pushing down on her index finger, and then with the tweezers actually taped to the handle of her fork, and then practicing pushing down on the food. So then you get to some final end point. And unfortunately I don't have a photograph of her eating the food. They're not her hands, so I can't lie about this. But in fact she was able to use a knife and fork to eat her meals. So that's where you can start to fill out that sheet with ideas about each of the skills you're going to train. Very quickly, this was a man just to give you an idea about the difficulties of getting people to practice, this is a man in Denmark who came to one of our classes, or our courses, and he was desperate to play his accordion again. Was not interested in a knife and fork for meals, could use his other hand, didn't interest him at all. And so anything we tried basically didn't gain his trust, I suppose, in that we were actually listening to what he had to say. Now, Annie had never trained somebody with a button accordion before, but anyway, his son brought the accordion in. The following day he showed us what his difficulties were, and the particular problem that he had was decreased in this conjunct rotation to get his ring and little fingers around to find the buttons that he needed to be able to get to on the side of the accordion. And also that common problem of decreased flexor strength in inner range. So he practiced moving across to a point across the palm of his hand, became more successful at that, pushing down on a piece of putty in the palm of his hand, and then went back to the accordion each time after he'd done some repetitive practice. And by the end of the session, he was much better able to control his ring and little fingers, even though obviously he couldn't see them, because your hands are out here and the accordion's in the way. So, don't be afraid to train a skill that you've never trained before. Get the person to try it, have a look, analyse carefully, and you'll come up with some effective solutions. And if you don't, then you know you've got the hypothesis wrong, and that's okay. There's nothing wrong with having the wrong hypothesis. The problem is if you haven't measured to see whether the person has changed or not. If they haven't changed and they've done lots of practice, then you're barking up the wrong tree. So you need to reevaluate and see what's going on. You will learn much more from the times you are wrong, from the times you are right. So it's really important that you're critical about how you go about analysing, because you will learn an enormous amount. Every time you see a patient, they will teach you something. You just have to be open to what they're teaching you. Very quickly, if you're going to train force production, which you can see people tend to, this is a water bottle with some of that respiratory tubing in it and a hole that's cut in the top that's quite snug, so there's no air that can get into the bottle. There's water in the bottom, there's markers here, and that's the level of the water there. So when you push on the bottle, the water goes up. But if you squeeze too hard, it squirts out the top. So you have to be quite sophisticated in terms of how you apply the force. So here's a man who had significant sensory problems, and so just to help him to keep his fingers together, tape them together so you have this sort of virtual finger, so he can now concentrate on using his thumb and his fingers together as a kind of unit on either side of the bottle to be able to coordinate the forces between the two. Just ideas. Okay, I'll hand over to Amy.
Okay, so handwriting is an area, a skill that I've had a number of students over the last 10 years doing research on, and in fact Nadesh, who's here, was one of the first master's students who looked at handwriting and what healthy older people typically do when they're handwriting. So you'll see, if you Google my name, you'll see a series of publications that have been conducted by students in conjunction with a colleague, Natasha Lennon. So I wanted to draw your attention to a publication that's just been completed, an intervention study by Bronwyn Simpson, where she recruited 7 people with stroke and provided training over a month to improve their handwriting. And so it's an online early publication. It's not one of those freely available ones, but hopefully many of you will have access to databases. And in the paper, she's got examples of the training program that we devised. So people would typically have goals around legibility. Almost all of the people who were recruited wanted to improve their legibility around some particular writing task. So you can see that half of the people had a signature problem. They wanted to be able to write a signature more legibly. Sometimes it was shopping lists. Some of these people were still working. There was 2 of the people in the sample, I think, who were still working, either in voluntary work or in paid work. And then some people had legibility and speed-related goals, but it's less common that people have a goal around writing fast. It's not so common. And then there's also a table in there showing the frequency of the practice tasks that Bronwyn prescribed for people's handwriting problems, depending on what their goals were. So you can see writing stories, or being able to write longer pieces of writing in their diary, lists for shopping or other activities. But writing your name and writing checks is pretty old-fashioned nowadays. Not many people write checks, but a lot of people do write notes and messages. And here are some of the examples of tasks that I've often used in handwriting training. So somebody who can't control the rotation of a pen, or they're not able to move their fingers up and down the pen to adjust the position on the barrel of the pen. So here the person's rotating the pen with a marker on the barrel of the pen and trying to improve their control and their coordination and rotation. And then you've got another exercise here when people are really slow to move across the page while they hold on to the pen from word to word, and they can practice whatever size of page they would normally use, writing keywords relevant to their practice on different parts of the page. And then for legibility, identifying which particular letters are most problematic or most difficult and illegible, and then practicing them. So not just giving them photocopied sheets of handwriting out of your filing cabinet, but being really specific. So this is task-specific handwriting training. And then putting it into the whole context. If they're wanting to write a passage in their diary, or they're wanting to write shopping lists, practice the components, and then look at the whole task, the whole word, or the whole paragraph. So you'll hopefully find that a useful resource if you're training handwriting. A little bit on constraint-induced movement therapy. Some of you will have been to our 2-hour workshop that we ran at the end of last year, and so I'm not going to spend a lot of time on this. This is a workshop that takes 4 days for most of us who've done specific training. So in 3 minutes, I'm not going to give you an awful lot of knowledge about it. But for people who have got advanced hand coordination problems, it's an intervention that most therapists know about, they've read about, and they do not use. So if you're in that category and you work in a practice or with a group of therapists who are in that category, think about what the barriers are, and that's the reason for our workshop last year, was to think about the barriers to conducting constraint therapy, particularly in the private health sector, so that you can garner your resources together and offer it either to individuals or to a small group of people over a couple of weeks. So what it involves is not just the restraint. The restraint or the constraint is the least important part of constraint-induced movement therapy. There have been 2 or 3 trials showing that people who didn't wear a restraint but did all the practice still got the same outcomes. But it's what you all think of, typically, when you think of constraint-induced movement therapy. So it's the intensive practice, the coaching, the one-to-one coaching. So you can't reduce the supervision down to nothing. You have to have some coaching and a therapist or somebody giving feedback to the person during their practice. The restraint initially stops people from using their other hand, their good hand, to help all the time. And then this package of homework tasks that people do to apply the principles once they leave your 2-week program. So this is an example of what might go on in a day program. Somebody might be with us for 3 or 4 hours, and they might do a circuit of timed tasks for a period of an hour. So they might, for example, do 6 or 7 tasks in an hour, each of them repeated for 10 times, and then the performance gets graphed and they get some feedback at the end. So they might be doing tasks like flipping dominoes, using Chinese stress balls, pressing computer keys, whatever seems to be appropriate for their particular problems, whether it's conjunct rotation or thumb abduction or thumb rotation. Here's an example of one man who wanted to be able to use his electric drill. He identified that when we did the Canadian OP measure with him at the beginning of the program. And so his practice to improve his electric drill use was on day 2 or 3. He was using a laundry bottle with water in it, and he had to pull the trigger in the same way that you might use an electric drill, and do that repeatedly so that the water hit a towel that was on the wall in front of him. He also had to be able to hold his arm up against gravity, which he couldn't do well. So part of his practice was being able to hold his arm up to a dot on the wall for a specified amount of time, and he would do that for a period of 30 seconds, and then he would repeat it. The next day he was using an electric a plastic drill, so it was a child's drill. It was lightweight, but still had a trigger that turned the little screwdriver, and he had to hold that against the dot on the wall. So what we're doing is looking at the whole task and then doing some part practice to bring it closer to the whole task. And then eventually, in the second week of the program, he's doing this, which is a bimanual task. You don't use an electric drill with one hand. But he was beginning to do that, and he was very keen to practice this at home, of course, as well. You may remember this lady from the previous presentation that we did. This is a lady who wanted to use her keyboard and hold down the switch key or the shift key with her left hand with her little finger. And so she's practicing what Karl was describing before, being able to flex her MCP joints without her IP joints flexing. And that's the reason for that little splint on her finger, is really to stop her IP joints from flexing so she can get the idea of flexing the MCP joints. using her lumbricals. And then on the next video here, she's got a target. She has to extend her MCP joint and extend her little finger up out of the way. And she's still compensating a little bit by using her wrist as well. She's getting feedback about that during the practice. So that table that Karl showed you before, you might have somebody who has just coordination problems, but more typically, like that man you saw in the two videos, he has problems with strength and coordination. But more problems here around coordinating wrist extension with thumb abduction and finger control. So if we think about what the evidence suggests, we have two systematic reviews that were published about 1.5 years ago. Lots more trials since then, but in summary, the Cochrane review that was conducted and published in 2014 indicates that there's moderate quality evidence that constraint therapy improves hand and arm function. Mental practice mirror therapy also do, and there are other interventions described there. So from that particular review, this is a forest plot that you're seeing on the screen showing that across to the right-hand line of that vertical line, any of the diamonds that are across on the right-hand side and any of those horizontal lines, which are the confidence intervals, show that there's significant benefit for people in the intervention group compared with the control groups. This is a second systematic review published around the same time by the Dutch group, and similar results. There are also systematic reviews that you might like to follow up about mental practice, electrical stimulation, which you may sometimes need to use on the thumb if somebody can't get their thumb to abduct or to rotate. And constraint therapy, which has got the largest body of research. So the Lancet Neurology one, these are both freely available to you. 51 randomized controlled trials in the top left one, 42 randomized controlled trials in the bottom right, including the acute population, a smaller body of research on people in the early hospital stay, but lots of studies around people who are longer term. So the common feature of all of those trials and those systematic reviews is that if we provide people with strength training, with interventions that allow them to practice and get messages from their brain to their hand, like mental practice, mirror therapy, and ES and constraint therapy, the common feature of them is task-specific training, intensity of training, lots of repetitions, and often that is done without us being there all the time. So how do you increase practice? You may have seen this from the previous lecture. There are 2 or 3 studies showing that you can drive a lot of practice, but you have to think about it, and you have to plan for it, and you have to record the repetitions. So this study was without patients, it's a small sample, and if people were given the goal of doing 300 repetitions in an hour-long session, sure enough they could do it. And they could also get a significant change on the action research arm test in a fairly short time, 6 weeks. Think about the number of weeks that sometimes you see people for. Can you get that kind of outcome? And then they did the similar study with inpatients, so it's a harder population to recruit because they've got so many other appointments and things going on. Same thing, they got a target of 300 repetitions in the session, 3 sessions a week, and they were almost up to 300 consistently. So a mean of 289 repetitions, with a confidence interval or a range between 280 and 299, and an even bigger change in their measurable hand function based on the ARIT. A recent study that was published by an Australian cohort, Leo Ross did this study as part of his master's research a number of years ago, and he's just recently published this paper in the British Journal of OT, describing how they got the extra practice happening for the people in the study that he was involved in. So what he showed was that people were doing an average, not of 300 repetitions, but 186 repetitions. And their hand function on the action research arm test, this is the intervention group, changed from a mean of 10 up to a mean of 21 points on the action search arm test. So that's certainly clinically significant. And a reminder about measuring change. Karl talked about this before, so you've seen examples in the slides and the videos of measuring time, repetitions, and there are other measures in there of size of the object, distance, and so forth. There are standardized measures that you can use, the box and block test, the 9-hole peg test, the number assessment scale, the ARIT. But a lot of the measures you've seen in the slides today are very simple measures that you can take and then review from session to session. So take home messages and then we'll see if there's any questions, but we might stop the recording just to keep it not too long. You need to analyse each skill carefully, and once you get more competent and confident, you enjoy the different skills. We've had to look at training turban tying, and there are lots of videos on YouTube of how to tie a turban in different ways. There's a whole range of tasks that you might be faced with, so don't be shy about that, and use your colleagues to help you if you need to. Think about what muscles are involved and how they work together. Think about the importance of the hand driving the shoulder. Keep your hands off. Just use your hands to give people an idea, but don't keep them there. Set up practice so that people can do their own homework and get high repetitions. Practice doesn't have to be perfect. Think about what practice people are going to do, negotiate that with them. If they say they're going to do 300, then make sure you see how much they've done between their sessions and review it. And as I said before, expect that people will improve. So at that point, we might take some questions. There's some references there as well that you're welcome to follow up and read as well. We might stop there.